Hello friends, welcome back to my YouTube channel Doctor's Corner. Today we are going to discuss about a very important topic, Lepra reaction. Okay, so we'll be discussing very briefly about this topic within next 7 to 8 minutes. So what exactly is this Lepra reaction? So Lepra reaction are the inflammatory reactions occurring in leprosy. So friends, you know that leprosy is a disease caused by bacterium, that is Mycobacterium leprae, and basically this disease affects the skin and the nerves. So during the course of this disease, or during the treatment of this disease, so in any other video we'll discuss about in detail about what is leprosy, what are the types of leprosy and all. Today we are just concentrating only on about the Lepra reaction. So basically it's an inflammatory reactions which are occurring during the course of the disease or during the treatment of the disease. For example, just imagine a patient. Okay, a patient is diagnosed as a leprosy, and he or she is on anti-leprosy drugs. Okay, so it could be a paucibacillary or multibacillary leprosy, and on the treatment of for 6 months or 1 year. So initially few lesions may be there. Okay, for lesions may be there, and the treatment continues, and after some weeks the patient comes to you stating that earlier the lesions was okay, but suddenly after some weeks after the treatment the lesions became intense or erythematous and indurated. Okay, so that is mainly because the host, that is the patient's immunological response, there is some inflammation has occurred against the antigens of the Mycobacterium leprae, and due to that reactions, due to that inflammatory reactions, that erythema or induration is seen, and that reactions are usually known as Lepra reaction. So that is basically the type 1 Lepra reaction. So Lepra reactions are basically two types. Okay, it's an inflammatory reactions occurring in the leprosy. It is basically of two types: type 1 Lepra reaction, type 2 Lepra reaction. One more, if you consider it even as a type 3, that is known as the rarest form, that is the Lucius phenomena. We're not going to discuss right now about that. We are just focusing about the type 1 and type 2 Lepra reaction. Okay, so what is type 1 Lepra reaction? So it is a delayed type of hypersensitivity reaction to Mycobacterium leprae antigens. So it is also known as type 1 Lepra reaction. So delayed type means it is the type 4 hypersensitivity reaction. So remember a rule of 5. So many a time students get confused and they use this mnemonic as a rule of 5, that is type 1 Lepra reaction is type 4 hypersensitivity reaction. That is, if we add this thing, type 1 Lepra reaction and type 4 hypersensitivity reaction together, it will become as 5. That is rule of 5. So most oftenly it occurs after the treatment of the leprosy has been started, but it may also occur before the treatment and after the end of the treatment. Okay, so it reflects the strengthening of the specific cellular immunity against the Mycobacterium leprae towards the tuberculite type. Okay, so basically when we start the treatment, then what happens is the bacterial load reduces and the that is the host response gets strengthened, okay, against the Mycobacterium leprae, and we get this one inflamed reaction. So one thing to remember in type 1 leprosy reaction is, so basically this type 1 leprosy reaction usually occurs on the existing lesions. Okay, on the existing lesions. So these existing lesions becomes erythematous and indurated. So who gets this type 1 Lepra reaction? Borderline tuberculate leprosy, borderline leprosy, and borderline lepromatous leprosy. Okay, so these three types of leprosy patients will usually get this type 1 Lepra reaction. So what are the signs and symptoms or the clinical features of this? So as I said that in the existing lesions, remember in the existing lesions, so there could be erythema and induration, and sometimes in intense phase ulceration can be seen. Okay, then one more important thing is nerve involvement can also occur in type 1 Lepra reaction. Basically it will affect the cubital, sciatic, external popliteal, facial and cervical nerve. So this is the most important point of this Lepra reaction. Because of this inflammation, it will involve the nerves, okay, and causes the neuropathy, and ultimately it may leads to the pain, tenderness, and ultimately the paralysis, loss of sensation and paralysis, which leads to the deformity. So this lepra reaction is one of the important cause for the deformities in the leprosy because of the involvement of the nerves. So you can see in this pic, the existing lesions have become the erythematous and indurated. Okay, and in this patient there is nerve involvement, so you can see the facial palsy. Okay, facial nerves is involved, facial palsy, and the claw hand. So you can see the claw hand and the loss of the longitudinal arch, okay, with flat and the boat shaped foot. So the nerves of the upper limb and the lower limb both can be involved, and it may lead to the deformities. Okay, so not only the skin lesions, also there is nerve involvement in the type 1 lepra reaction. So how it is diagnosed? So clinically we can suspect the type 1 lepra reaction, but a skin biopsy may reveal a granuloma and multinucleated gland cells, and the edema can be seen. So how to treat this? So basically it requires the supportive treatment and requires the treatment like painkiller, that is NSAIDs, and monitoring. But the drug of choice is the steroids, basically the oral steroid prednisolone 0.5 to 1 milligram per kg per day. So cyclosporine and other drugs can be continued. And remember, so the treatment with rifampicin, dapsone, and clofazimine should continue. That is, these are the anti-leprosy drugs. Okay, so generally for anti-leprosy, what we give, rifampicin, dapsone, that regime should be continued. And in addition to this, if there is a type 1 lepra reaction, we can give steroids too. Then what is type 2 lepra reaction? So this type 2 lepra reaction, again, it is characterized by an acute immune complex vasculitis affecting the skin and the other organs. Remember, it is the type 3 hypersensitivity reaction. If you remember, I have just now said that rule of 5. Okay, so type 1 is the type 4 hypersensitive reaction, and type 2 is type 3 hypersensitivity reaction. So if you add this together, the ultimate result should be 5. So how to remember which hypersensitivity reaction is type 1 and type 2? Type 1 is 4, type 2 is type 3 hypersensitivity reaction. Okay, so this type 2 hypersensitivity reaction, it is also known as erythema nodosum leprosum, ENL, erythema nodosum leprosum. So why it is called as erythema nodosum leprosum? Because in the type 2 lepra reaction, there are new lesions which are erythematous nodules, that is nodules which are erythematous and seen in the leprosy. That's why it is erythema nodosum leprosum, ENL. In type 1, the inflammation was there in the existing lesions, but in type 2, new lesions, new erythematous nodules are seen. Okay, and painful nodules are seen. So these are the pics of the new ENL, that is the erythema nodosum leprosum, that is the type 2 lepra reaction. Okay, new lesions which are scattered here. So who gets this? So lepromatous leprosy, borderline lepromatous leprosy. So this types of leprosy usually gets this type 2 immune reaction. Okay, so type 2 lepra reaction is commonly associated with puberty, pregnancy, and lactation state. Okay, so what are the clinical features, as I already enumerated? So it depends on the severity and which organs are affected. So mainly the lesions are scattered on any part of the body, but mainly up to the extensor aspect of the limbs and on the face. Okay, so multiple small red painful nodules, okay, may be seen on sterile pustules, and ulcers can also be seen. So the lesions may be superficial or it can be deep even in the dermis. So apart from this, some systemic complications may also occur, so which include that iridocyclitis, that is inflammation of the in the eye, then orchitis, inflammation of the testis, renal impairment, then proteinuria, then cytolytic cholestasis, and fever, fatigue, enlarged lymph nodes, and swollen painful red joints. Okay, that are the clinical features of this. So it is usually clinically suspected, but diagnosis can be done based on the lab test. So blood tests may show the high inflammatory markers like increase in the WBC count, and the high protein C level can be seen. Sometimes renal and liver impairment occasionally can be seen. So pathologically it is essential to confirm the type 2 reaction. So a biopsy, okay, a biopsy of a new red nodule less than 24 ours shows an infiltration of the polymer superimposed on the chronic inflammation and a heavy bacterial load of Mycobacterium leprae. Okay, so what is the treatment for this? So remember, both in the type 1 and type 2, the drug of choice is the steroid, that is the oral prednisolone most commonly, so within dose of 0.5 to 1 milligram per kg per day, and supportive treatment which includes the NSAIDs or the painkillers and the control of the fever and the regular monitoring. That's the key for the treatment. Apart from this, the other drugs like clofazimine, and one more important one is thalidomide. Okay, so this thalidomide has a role in the treatment for type 2 lepra reaction. However, because of its teratogenic effects, so it's not used routinely, but however many studies have proven the role of the thalidomide for the treatment of the type 2 lepra reaction, and other drugs like cyclosporin, azathioprine, methotrexate, okay, then mycophenolate, this can be used. Okay, but the drug of choice is steroids. Okay, this is all about the type 1 and type 2 lepra reaction, and one more is the Lucius phenomena, which we'll try to discuss in some other videos. Thank you.